Hi friends, welcome to my channel Ophthalmology Academy. This time we're going to talk about preseptal cellulitis, which is actually an infection of the interior part of the orbit. And introduction is it's basically an infection of the subcutaneous tissue of eyelids. It's an infection of the superficial aspect of the eye. It is usually caused by gram-positive bacteria like Staphylococcus aureus or Streptococcus pneumoniae or Streptococcus pyogenes. And a mode of infection can be exogenous, that's by trauma, penetrating trauma, or by a scratch, or through insect bites, or it can be endogenous. Endogenous can be through surrounding infections like of paranasal sinus, there is any sinusitis, or if there is a dacrocystitis, or if there is for example a sty, which sty on the eyelid margin can lead to these. Or endogenous can also be in although rarely seen through hematogenous mode, that is an infection distant away can spread into the subcutaneous tissue of eye. This is a diagram of the upper lid. This diagram shows that this is the frontal bone with the frontal signs. This is the periosteum overlying the bone, and this structure is very important. Orbital cell, this preseptal cellulitis as well as in the orbital cellulitis. The infection anterior to this is called as preseptal cellulitis, while as if the infection extends posterior to it, it is the orbital cellulitis. Infection in preseptal cellulitis affects this area here. It can go even up and on the forehead also, and this area is the preseptal infection area of the preseptal cellulitis. Clinical features of the preseptal cellulitis are there is pyrexia, there's a fever because it's an infective pathology, infective process. Then there is swollen erythematous tender eyelids which are hot to touch, and these features may be associated with mild chemosis. There is, however, no proptosis. If the patient comes with an infective pathology in the eye and there is proptosis, it is an orbital cellulitis. Preseptal cellulitis and orbital cellulitis are very common differentials of each other. In preseptal cellulitis, there is no impact on the extraocular muscles, there is no impact on the vision, there is no impact on the pupillary reactions. While in orbital cellulitis, there is restriction of movements, there is more pain than the preseptal cellulitis, as well as there may be pupillary irregularities in the form of RAPD, and one can see that there is actually the fundal changes are there, like there may be papilledema, there may be choroidal folds also. This is very important differentiation, because we should not overlook any orbital cellulitis. We might think that this is preseptal cellulitis, but three things which I already mentioned is pupillary responses, extraocular muscles, vision. These are very important in differentiating preseptal cellulitis from orbital cellulitis. As you can see here, this is a patient with preseptal cellulitis. The eye is erythematous and swollen, while as this case you are seeing the conjunctiva is heavily chemosed, eyelid is boggy. As in this picture seen superiorly, you can see how much proptosis is there. So this is clear cut a case of orbital cellulitis, whereas this patient is having a preseptal cellulitis. Coming to the treatment of the preseptal cellulitis, It is as we treat any other infection, that oral antibiotics are to be given in mild cases. In severe cases, we can admit the patient and give intravenous antibiotics, and the antibiotics usually given is amoxiclav to cover this gram positive spectrum, or if you have to give injectable, it's better to give cephalosporins and give antipyretics because of fever and to take care of the inflammation. Warm compresses to give comfort and to expedite the process of healing. And incision and drainage, sometimes what happens is that preseptal cellulitis can develop into a frank lid abscess, so that time it's very important, it's imperative to drain the lid abscess. Complications of the preseptal cellulitis lid abscess. In my clinical practice, I have seen many patients coming with preseptal cellulitis, and within 2 to 3 days they develop into lid abscess, especially in children. And few patients can progress into orbital cellulitis if the infection is very invasive. It's very virulent. It can penetrate the orbital septum and cause orbital cellulitis, a very vision threatening as well as life threatening complication. It can cause meningitis and cavernous sinus thrombosis, a 100% fatal complication if untreated. This was all about the preseptal cellulitis. Hope you liked the video. Do like and subscribe my channel.